lose tone in the skin, and we also lose volume in the fatty areas. They become less robust. This drops, you end up with a fold. What Restylane Lift does is it's put in over the cheekbone area and basically lifts the cheek. It minimizes the fold without directly injecting the fold. The reason most plastic surgeons like it is because this is where a woman always puts highlights first when they go out and want to look their best. And number two, that's the direction we would pull if we were doing a facelift. So we find this works the best. Yes, in some people you may need to put some direct into the fold. You may need lip lines. This wonderful young lady has given us, who's our Galderma rep, has given us a sample of product to use. They have multiple versions of this. They have the original, which was Restylane. They now have Restylane Silk for lip lines or for conservative augmentation. They have Restylane Refine or Define for folds or for lips for augmenting, depending on how much you want to see, and Restylane Lift up here. They're the makers of Dysport, which is their version of Botox, which kicks in a day sooner and we found lasts a little bit longer. They also have a product called Sculptra, which became very popular on AIDS patients for wasting, and it's the only product on the market right now that will lift the lower face and fill volume. It is basically lasts 2.5 years, but you need multiple quote-unquote injections, and it stimulates your own collagen to grow, and that's the reason it lasts so long. These other products, the Lift will last you about at least 1.5 years. The Silk will last a year. The Define Refine will last a little bit longer than that. Each product will last a certain amount of time based on how it's formulated and what we're trying to do with it. So what we're going to do on my lovely model, who's had this before, is we're going to put a little bit.
We got the download bio. All
right, we're going to put a little bit into her
You pull
cheek,
her back. Yeah.
and we're going to try with my lovely wife who's doing the filming to be able to show you what we're doing. It's going to be 5 little pinches with a little baby needle, and then I'm going to try to position her face if I can, so that on the screen you'll actually see what it does to one side of the face. It's mixed with Novocaine. In people that don't really do well with needles, we have a topical cream you can put on first. She's tough as nails, so we don't need to do that. And there is Novocaine mixed with it.
Is it instant? Like you said, you will see like a little poof, and that will be whatever it goes to. Does that stay there, or does it develop over
It
time?
actually will grow a little bit more. Hyaluronic acid, which is what most of the fillers are made of, suck in water. So as that sucks in water, and this has the highest, what we call G prime, or ability to do that, it will actually lift it a little bit further. You'll find if, let's say I say 1.5 to 2 years, it's not like you wake up one morning and it's gone. At about 12, 13 months, all of a sudden you're going to see a little bit less. So a lot of my patients, as opposed to just waiting till it's gone, do tune-ups. So after a year, as opposed to typically using 1 and 1 to get going, they'll do a 1/2 and 1/2.
Top off the fuel tank.
Exactly. So that's what we're doing on Jen, although Jen's going to want more because that's Jen. But that's basically.
More's more for her.
I prefer my tank to be full at all times.
That's what we learned. More is more.
Anybody have questions other than the Galderma rep? Well, I hope everybody's watching, because now we're going to do Restylane Lift. We're going to give 1 syringe. We're going to do 1/2 on each side. It's about 5 pinches with a really, really, really tiny needle. Okay?
Yeah, I mean, we're very, very protocol driven, so it would be.
Little pinch.
Exfoliator. We have complexion renewal pads, which I would recommend for you, or oil control pads, and then our DNA.
Another little pinch.
And a growth factor serum. But it's what he
Another
calls
pinch.
the 5, which we stick to. But you really should tell that
Another pinch.
morning and night. thing about tonight is that there's a discount, there's like 10%
And another pinch.
So, yeah.
So we've just completed the injection. I hold a little bit of pressure on it to make sure we don't have any bruising or anything. And then what we're going to do is we're going to shape the product to give it the shape of her cheekbone. You can see your cheeks again. You're happy, right?
I'm always happy when you see my cheeks.
I would go with the complexion roll pads.
So we're just going to put a little ice on it and hold a little gentle pressure for a few minutes. Hammer around so you can see. I'm going to have you hold that.
It's a bunch of women.
Sorry. So we basically completed her one cheek. And I'm going to try to tilt you up so you can see the difference on the two sides. I don't know how it's showing up on the screen, Pat, but put that ice back on and I'm going to go look. I know that. So we've done her right cheek. It was 5 injections of basically a half of a syringe. And it's a little reddened from the ice. Tilt your head back a little. And you can see the difference on the two cheeks. God help me, they didn't drink that much wine.
I wish I did.
I think it would have been better if I was right in front of them.
Put her head forward.
You look directly in the camera. There you go. Zoom in there, Patty. That
You can put the ice after you zoom it in. All right, now we're going to do the other side. If you hear me out there, I can't tell.
They can hear you.
Little pinch. Little pinch. They haven't shut up once. Little pinch. Did you notice that?
It's women.
Yeah, but
I don't show
you'd
up either
think
unless I'm getting
they'd be
injected.
watching. Must have been the wine that you bled a little.
It's because they're women.
I'm just going to hold pressure a little longer. You, put the ice back on the right cheek.
So this is the small?
This is the what?
This is the small syringe?
No, it's just
We're talking about small.
Miss Jen usually goes for one syringe on the side.
Gotcha.
You know,
Whenever
I do
we've
the
only
one and then
done
I do
one, we do a half and a half.
I always want two, remember?
Shocker.
Because I love it, remember? Because my sunglasses don't fit right because of my cheeks.
I don't believe you.
Yeah, because it goes away too quickly.